Tonight in Medical Rounds, there's a lot of talk about genetic testing and breast cancer. Actress Angelina Jolie, at the age of 37, underwent a preventative double mastectomy after learning that she had an 87% risk of developing breast cancer due to a defective BRCA1 gene. Jolie did genetic testing because of a family history on her maternal side of her family. And joining us now to talk more about genetic testing and breast cancer risk is Megan Burgess. She is Director of the Hereditary Cancer Risk Assessment Program at Hartford Healthcare. Good evening, Megan, and thanks for spending some time with us tonight.
Good evening, Denise. Thanks for having me.
Well, the first question I have for you with genetic testing, who should get tested? People just with a family history of breast cancer or others?
Sure. So women with a history of breast cancer themselves, and then there are certain criteria, national guidelines that someone needs to meet in order to offer genetic testing. So for example, early onset cancers under age 50, rare cancers like ovarian and pancreatic cancers, male breast cancer. So there are certain guidelines that we follow.
Okay, and how is genetic testing done? I'm imagining they draw blood perhaps, and how soon do you get the results?
Sure. So blood sampling is an option. At Midstate Radiology, we do a saliva sample, and then I see the patients 6 weeks after their results come in to go over post-test counseling and make sure they understand the results of their test and what it means for their medical management and for their family members.
Is this something that's typically covered by insurance?
Yes, that's a good question. That comes up a lot with our patients. So there are guidelines in place. So if you do meet those guidelines, then insurance does cover the cost of the testing. So most patients pay $0 out of pocket.
And is genetic testing used for other types of cancer? We've been talking primarily about breast cancer.
Sure. So yes, for example, we test for 35 genes that check for the 8 most common types of hereditary cancer. So it's breast, ovarian, colon, uterine, pancreatic, prostate, and melanoma. So it does extend further than just the breast cancer.
Wow, it's great to know. As with anything, information, knowledge is power, and if you know, then you can take steps to helpfully mitigate your diagnosis or make the path easier from there. And we thank you so much, Megan, for this great information and promising outlook for women and for people everywhere. And if you'd like to learn more, just call the number you see on the screen right now.